Endometriosis affects 1 in 10 women, and there's so many myths about endo, and it creates a lot of confusion. So today, Stephanie and I are going to go through what some of those biggest myths are and give you some information to help navigate and get you where you need to go. So endometriosis is most commonly thought of as a gynecological disease, and it's characterized by two main things, oftentimes unexplained infertility and painful periods.
So almost always they will be given oral contraceptives or birth control pills. Now, it is not true that birth control pills treat endometriosis.
Yes, birth control pills can actually help the symptoms of endometriosis, but they do not stop the progression of the disease. And they also have a lot of negative side effects on the gut health and nutrient absorption, which can actually further exacerbate endometriosis.
And so women may feel better taking the birth control pills because what it basically does is reduce your circulating estrogens, which feed the endometriosis implants. And so it may make someone feel a little better to have this hormonal suppression on their menstrual cramps. But as you're mentioning, it doesn't come without consequences. So there is a negative effect on the gut, and it also has a negative effect on our vulvar tissues.
So the myth is that endometriosis can be just diagnosed in an office visit. And while there's merit to a clinical exam and a history, you can only truly get a diagnosis of endometriosis by a surgical excision or biopsy of that tissue, which is sent to a pathology lab and then confirmed endometrial-like cells.
But another situation that actually happens is because you have to diagnose it via surgery, many women go in for an endometrial biopsy and surgery and think they're actually getting a therapeutic surgery for their endometriosis. But it's really important to understand, is it just for the biopsy or is there actually going to be excision or ablation treatment with the procedure?
Yeah, an ablation will just burn the lesion, and that may be helpful for some women that have kind of superficial disease, but with a different type of endometriosis, like deep infiltrating endo, you actually have to remove the lesion because it goes down deeper, and the only way you can actually know if it's deep infiltrating is to remove it. So while some women can actually report improvement after an ablation surgery, they might not have that type, but you'll never know unless it's excised.
And this is a little bit of a dilemma within itself because similar to other pelvic pain syndromes, this isn't a specialty entirely on its own. And so when women are thinking they may have endometriosis, we think it's really important to see an endometriosis specialist versus just a standard gynecologist because we're not sure of their range of experience and their type of surgical expertise in dealing with something that's specific. And it's important as we go back, 1 in 10 women have endometriosis, and studies have shown that it isn't just endometriosis that causes pain in these women. 90% of women with endometriosis also have musculoskeletal dysfunction, including pelvic floor dysfunction and central nervous system sensitization, which really brings us as pelvic floor PTs into the treatment plan to help deal with the somatic consequences that come from having painful periods every month.
In addition, 90% of women also have IBS. And so that can be a major pain generator. If you've had IBS since you were young, that may actually be a generating factor for endometriosis. We start to now look at endo as not just a gynecological disease or a hormonal disease, but we look at the immune system and how that's regulating both the development of endo, but also how it exacerbates someone's symptoms.
When you talk about all of those factors, this is why surgery by itself is not usually therapeutic enough. So many women will go have surgery and then expect to feel better, and they may not. And it's not because the surgery was wrong or the surgeon didn't do a well enough job, but if the surgeon isn't comprehensive to address all the things that you're talking about, they still may not feel well. So surgery is one part of the picture, and we do support that because there's no other way to remove the endometriosis lesions. The therapies that may be offered conservatively for women that include oral contraceptive birth control pills or other hormonal suppressive therapies come with such severe side effects, they essentially put the woman into menopause to try to reduce the endometrial lesions, but that comes with consequences to our cardiovascular health, to our bone health, definitely our musculoskeletal health, and will cause vestibulodynia, which is another source of painful sex. And so when we're really working with women with endometriosis, we want to strengthen their immune system, we want to address the gut dysfunction, and treat the musculoskeletal and central nervous system causes of pain.
Yeah, speaking of pain, I think a big myth is that painful periods are normal.
Ugh.
Painful periods are never normal, although they're common. So, a typical scenario is that as you get your period as an adolescent, you have pain, you might be missing school, you might be constantly going to the school nurse's office, and when you talk to your mom about it, she may say, yeah, that's normal. I went through that, my mom went through that. And that's because there's that genetic predisposition. So women are 7 to 10 times more likely to have endo if they have a family member that also has endo. And now this conversation becomes normalized. Yes, you have painful periods. That's what it's like. You're a woman, and that's just what you have to do about it. Take some Advil. That is not an okay solution. You want to figure out why that is. And actually, taking Advil for every month for years can also further exacerbate any gut dysfunction that's going on, which then furthers the exacerbation of endometriosis. And so there can be other supplements that are natural that we need during that time, like magnesium is a great supplement for women to reduce the use of NSAIDs or Advil and to help with the pain generation during that time. Many women actually have trouble conceiving because of endometriosis lesions. And once everything's ruled out as far as certain blood work and how your ovaries are working, it's sort of this unexplained infertility. But actually, it's the endometriosis lesions causing hormonal imbalances, causing inflammation. So it's not the right environment for you to be able to get pregnant. So undergoing IVF treatments, which are very expensive, may not even be worthwhile until the endo is at least addressed and diagnosed.
Research has shown over and over again that women who have pain issues are often treated poorly by the medical system. And now that all this information is becoming more widespread and better well known, hopefully the landscape is improving.